someone who has over 30 years of practice as a dental surgeon. She is the director and dental surgeon, permit me to add general, at the Osagie Dental Clinic located here in Lagos. Welcome to the program, Dr. Mrs. Angela Giwa Osagie.
Thank you very much.
It is a pleasure to have you once again.
Thank you.
So we had, I had you once on the show, and you gave a general overview of what dental health is supposed to mean, especially with regarding to how you had seen it in your practice. And today we are narrowing down on tooth decay. Tooth decay is such an important topic because I have a personal experience. I was telling you before the show that I've had my second left molar taken off, and then I still have another hole. Viewers and friends out there, sorry, but I must confess, I know that there are a lot of you who can relate to what I'm talking of right now. Talking about tooth decay, how common is it in your practice?
Tooth decay is the commonest ailment pertaining to the oral cavity. What is tooth decay? Tooth decay is when the enamel, which is the outer layer, the outermost layer of the tooth, breaks down due to the activity of acid attack on the tooth. Acid is formed because of the sugar intake which we take in, and it reacts with the plaque, that is PLAQUE. The plaque is made up of the food stuff which remains on the teeth, plus the bacteria which is naturally present in the mouth, and the sugar plus the plaque produce acid, what is acid? Acid is very erosive and corrosive, and that acid, eats out the enamel of the teeth, and that is the beginning of tooth decay. The correct clinical term is dental caries, and that is the beginning of dental caries.
Okay, so you have rightly mentioned that dental caries, or tooth decay in layman's language, occurs as a result of the action on bacteria on food that has been eaten, sugars from food actually, that now interact with plaque.
Yes.
And when that bacteria acts on such sugars, acid is produced.
That's correct.
And when you mean enamel, in layman terms, you're talking about the white part,
That's
the
correct.
hard part of the tooth.
That's correct.
Now,
yes.
When I had the second incident, the headache was so bad. At a point, I was wanting to think, God forbid, do I have a brain tumor? So, diagnosis can be quite confusing, isn't it? In terms of making diagnosis of dental caries.
Dental caries can manifest itself in the form of pain. And that is what we call toothache. And pain from your mouth, specifically a particular tooth, indicates that there's something wrong with that particular tooth. Because of the distribution of the nerve supply to the various parts of our jaws, the pain you're experiencing may not necessarily be from that particular tooth, and it's referred to as referred pain. You may have tooth decay in the lower jaw, but you'll be feeling pain in the upper jaw. opposite the tooth that is bad. And that is called referred pain. When that happens, a lot of us just keep self-medicating, taking, pain-killing tablets, and it will go. And then it may come back, it may even keep you awake at night. And it is maybe at that stage that you decide to go and see a dentist. Whereas, maybe you should have gone for your regular 6-monthly checkup, and that small bit of tooth decay could have been detected at a very early stage when the decay was very tiny. So that's what tends to happen. We wait until it gets very bad, and it may have to be extracted, as you had in your case, whereas 6 months or maybe a year ago, it was just a tiny bit of decay, which could have been cleaned out if you had visited the dentist, and replaced, the cavity replaced with a filling, and the tooth ultimately saved.
Oh, well, a lot of us are guilty as charged for this particular crime. And I wanted to dwell on making a diagnosis more often, because the patients will come to us general practitioners, medical officers mostly. They'll come to us, and then I'm aware that in many parts of the country, once some patients just go and say, I'm having a headache, some doctors do not even care to examine properly, and next thing they treat for typhoid. And then that's how they keep treating, unknowing to saving the tooth. How important is this factor?
It's very important.